Bismillah ar-Rahman ar-Rahim. This lecture is for the first grade medical college in AL-IRAQIA University. We will talk about the joints of the upper limb. As we mentioned in the previous lecture about the general introduction about the joint structural and functional classification, now we will come to each joint by its own, and we try to illustrate knowledge about it. We have the sternoclavicular, acromioclavicular, shoulder joint, elbow joint, radio-ulnar joints, wrist, and joints of the hand. To understand these joints, we should focus on, for each joint of it, we focus on several points. We should know the type of the joint, articular surfaces, ligaments, movements, and we mentioned some of the clinical correlates. Clinical correlates in the joint, we mean dislocation. So if we achieve each point of this, we will understand and have a full information about these joints. Starting by the shoulder girdle, حزام الكتف. If you are asked, what is the shoulder girdle consist of? You should answer, it consists of two bones, the clavicle and the scapula. The upper limb is connected to the trunk through the shoulder girdle. And the clavicle and the scapula are the two bones that connect the appendicular upper limb to the trunk. The sternoclavicular joint and the acromioclavicular joint are two joints related to the clavicle. This is the clavicle bone, and as we know, it is the only long bone which is transversely seated in the human body. And it has two ends, the sternal end and the clavicular, or the acromial end, the acromial end. The sternal end will articulate with the sternum, forming the sternoclavicular joint. The acromial end will articulate with the acromion process of the scapula to form the acromioclavicular joint. These two joints, to know the type of them, we mentioned that the synovial joint is the majority of the joints in our body is of synovial type. So it is synovial joints. To know the type of them, لازم مو بس نذكر synovial, what type of the synovial. يعني اللي أخذناها اللي قلنا عليها hinge, planar, pivot, saddle, لازم we should mention. يعني we say that the sternoclavicular joint is a synovial saddle joint. The acromioclavicular joint is a synovial planar joint, mentioned like this. These are the types. نيجي أكو فد خاصية تتميز بيها. There is a special thing to be mentioned. We all know that the articular surfaces of the bones forming the joints are covered with hyaline cartilage. هذا فشي شرحنا synovial joint وقلنا articular surfaces are covered by articular cartilage اللي هو hyaline cartilage in order to يعني يمثل cover to these ends and to lubricate من يصير movement with the other end. In the sternoclavicular joint and in the acromioclavicular joint, the articular ends are covered by fibrocartilage. هذه فد ميزة الله سبحانه وتعالى منطيها in order to add anything fibrous in the body means more stiffness, means more stronger. So in order to have more strength to these joints, medically and clinically, you should know that the articular surfaces of these two joints are covered by fibrocartilage, not hyaline cartilage. Okay, another خاصية, another property, which is also a characteristic of the sternoclavicular joint. When they come to describe it, they say it's a complex joint. لأنه it has a fibrocartilage disc inside the synovial cavity, dividing it into two compartments. So حتى بالتقسيمات مالتها يجي يقول anterior or posterior compartment وهذا يصير بفلام movement وهذا يصير بفلام movement. This is not for you, this is for postgraduate يعني, but I want you to know that it's a complex joint having a disc inside its cavity, dividing it into two compartments. This also adds into the strength of the joint to give it more strength and to be more stabilized. Also, the acromioclavicular joint has a disc inside, but with a hollow يعني مو رينج يكون كامل مثل الستernoclavicular joint اكو فتحه موجوده, but it also has a characteristic of having a fibrous disc inside the synovial cavity. Okay, we return to the sternoclavicular joint. To describe it, we said it is a synovial saddle joint. This is the type of it. The articular surfaces is the sternal end of the clavicle with the clavicular notch of the manubrum of the sternum. These are the articular surfaces. When we come to the ligaments, all the ligaments of the joints, number one, تحط fibrous capsule. يعني for all the joints of the body, when you enumerate the ligaments for it, number one, you mention fibrous capsule. The capsule, اللي هو cover of the joint, is considered ligament number one for each joint. يبقى attachment of the capsule from where to where. حتى when you will read, if you return to the textbook, he will mention exactly the borders or the alignment of the fibrous capsule for all the joints of the body. It's not for you. Don't try to memorize it. بس تقول number one fibrous capsule is the ligament number one you should add to the joint. Number two, the ligament of the sternoclavicular joint, I have anterior. مثل ما قلت anterior بالتشريح معناها أكو posterior. Anterior and posterior sternoclavicular ligaments from the sternum to the clavicle. Anterior and posterior sternoclavicular ligaments. These are ligament number two. Ligament number three, I have this ligament which will be from side to side, from the right to the left, called interclavicular ligament. It is even on the sternal notch of the manubrum, يعني يمتد من جهة إلى الجهة الأخرى, and this strengthens the two joints and connected with each other. The interclavicular joint is ligament number three. Number four, I have a ligament from the costal cartilage of the first rib. يعني I have the first rib with its costal cartilage. There is a ligament called costoclavicular ligament. This is also a strong ligament, triangular in shape, as you see. Its function is it prevents the joint from dislocating posteriorly. يعني clinically, if we come to a clinical correlate of the sternoclavicular joint, does it dislocate? Yes, it can be dislocated, but it needs a very, very strong force. يعني عادة these two joints, the sternoclavicular and the acromioclavicular, are very strong, بحيث انتقال القوة from the upper limb through the acromio, through the clavicle, through the sternum, sternoclavicular to the sternum, high convey of the force. Sometimes if it's a blunt trauma or injury, it will cause fracture of the middle clavicle instead of causing dislocation of these two joints. هاي هالقد ما هذني two joints قوية, فمرات ينكسر الكلافيكل وما تنزاح. هذني two joints will not be injured. So, but we should put in our mind it can be dislocated if there is a type of force or injury subjecting it to be dislocated, more dislocated anteriorly than posteriorly. يعني anterior dislocation of the sternoclavicular joint is more than posterior dislocation of the sternoclavicular joint, and this is anatomically explained because of the presence of the costoclavicular ligament, which prevents the joint from dislocating posteriorly. And if it occurs, if it will dislocate posteriorly, it needs a very emergent intervention in order to return it, and behind it there are great vessels of the neck. يعني it will be very critical for life. So this is the clinical correlate of the sternoclavicular joint. Quickly saying the ligaments, as I mentioned, anterior, a fibrous capsule number one, anterior sternoclavicular ligament, posterior sternoclavicular ligament, interclavicular ligament, costoclavicular ligament. This is the sternoclavicular joint. If we come to the acromioclavicular joint, to mention its type, we said it is synovial planar joint. articular surfaces is by the acromial end of the clavicle and by the acromion process of the scapula. The ligaments which are present, number one, I have the fibrous capsule. Number two, I have superior acromioclavicular ligament. مثل ما قلت superior معناها عندي inferior acromioclavicular ligament. Superior and inferior acromioclavicular ligaments. I have another ligament which is from the coracoid process to the clavicle called coracoclavicular ligament. The coracoclavicular ligament consists of two parts, one medially and the other laterally. The medially, as you see it from its shape, is cone shape. مخروطي الشكل, it is called the conoid part. The lateral part is, as you see it, rectangular, so it's called trapezoid parts. So I have the conoid part and the trapezoid part. The medial is the conoid, the lateral is the trapezoid. From the they are both parts of the coracoclavicular ligament. They are also strong ligaments considered as ligaments of the acromioclavicular ligament. If we come to the dislocation, it can be dislocated either superiorly or inferiorly. وهمينا ما كلش قليل إنه يصير بي dislocation وممكن الكلافيكل ينكسر وهو يبقى ثابت بمكانه. But even so, sometimes dislocation can be occurred in very traumatic blunt injury, leading to superior dislocation more than inferior dislocation can occur. And also the cause is the presence of the coracoclavicular ligament. It prevents it from being dislocated inferiorly. These are the two joints. If we come to the movements, we all know the joints are articular surfaces between two bones, two meeting bones, and movements should occur. من نجي to illustrate the movement of both joints together. من نحكيها سوية لأنه أصلاً the scapula with the clavicle, with the acromioclavicular joint and the sternoclavicular joint move together in order to give movements for the upper limb. So the movements in this region for the two joints will be protraction, retraction, elevation, and depression. اوكي هاي الموفمنتس اللي ممكن انه تصير اللي هي protraction, retraction, elevation and depression of the two joints. This was a full and quick review about these two joints. I have a subject important to be mentioned, which is called the ligaments of the scapula. We all know, you studied the scapula as a bone, and you know that there is the suprascapular notch. You know that there is the spinoglenoid notch also. There are two ligaments present here called the suprascapular ligament, converting it into a foramen, and I have the spinoglenoid ligament, converting it also into a tunnel. There are structures passing through the suprascapular vessels and the nerve. For the suprascapular ligament, in order not to forget who passes above the ligament and who passes through the foramen, there is an English quote that says, the Navy passes under the bridge while the Army crosses over. The Navy, الN اللي بالبداية يعني the nerve under the bridge يعني جوا الليجمنت يصير، والارتري the army اللي هو A artery passes over. هاي حتى لا تنساها. بينما من تجي على السباينوغلينويد tunnel, all of the يعني van مثل ما نقول الفين والارتري والنيرف will pass beneath it, below it. And these two ligaments are important on the scapula. يعني خاف يجيك موضوع illustrate the ligaments of the scapula. You should mention the suprascapular ligament and the spinoglenoid ligament. Do I have another ligament? Yes, I have a ligament from the acromion process to the coracoid process called coracoacromial ligament. اللي هو very important for the shoulder joint. يعني هاي أنا جيتها كمقدمة حتى من نحكي عن shoulder joint. I will return to the coracoacromial ligament furtherly. Okay, now we will talk about the shoulder joint. The shoulder joint is a very important joint in the upper limb, connecting the upper limb to the trunk, and it is one of the only joint in the body that has a wide range of mobility. But this is on the expense of its stability. Yani if we are asked which joint in the body is highly mobile, we say the most mobile joint is the shoulder joint. But at the same time, it can be considered as one of the weakest joints. Why is that? Due to the structural anatomical formation of this joint. If we come to describe it anatomically, the type of it is synovial ball and socket type. The head of the humerus sits, yani the articular surfaces is the head of the humerus with the glenoid cavity of the scapula. These are the articular surfaces. The head of the humerus is 4 times larger than the glenoid cavity. And this is the cause. This is why mobility will be more, but the stability will be less. The الراس of the humerus is 4 times larger than the glenoid cavity. But there are some points that add for the strength of the shoulder. يعني أكو نقاط تشريحية تقوي shoulder joint. And if we come to the ligaments, we will mention it. وراح تبين هنا نقاط القوة اللي موجودة اللي تقوي shoulder joint. Ligaments of the shoulder joint, number 1, مثل ما mentioned, we should mention the fibrous capsule. Also, men attached when attached to the glenoid and attached to the humerus, points of attachment, not for you. Number 2, I have ligament from the glenoid to the humeral. So it is called glenohumeral ligament. These glenohumeral ligaments are divided into 3 parts: superior, middle, and inferior. Superior glenohumeral ligament, middle glenohumeral ligament, inferior glenohumeral ligament. مقسمة 3 bands. These add to the strength. Number 3, I have a ligament which is called the Coracoclavicular ligament. يعني from the acromion process to the from the acromion process of the scapula to the coracoid process, there is a ligament called the Acromiocoracoid ligament. This represents the secondary socket of the head of the humerus. What do I mean by this? The primary socket was the glenohumeral articulation. طبعا الشولدر أيضا يقولون عليه مصطلح glenohumeral articulation لأنه بين الglenoid cavity والhead of the humerus. This is the primary socket. The ligament between the acromion process and the coracoid process will form an arch. This arch consists, يسموه coracoacromial arch, consists of the coracoid process, coracoacromial ligament, and the acromion process. This represents the secondary socket for the head of the humerus. I mean by that, when the humerus moves يعني in abduction, من يصير abduction, يخلص منطقة التقاء باللابرم ويحتاج بعد سوكت آخر حتى يحميه بعد أكثر ويكمل الموbility of the joint. This is called the secondary socket of the humerus. It will add to the strength of the shoulder joint. So, the coracoacromial ligament is considered also one of the ligaments of the shoulder joint, forming the arch, forming the secondary socket for the shoulder joint. The other ligament I have called the transverse humeral ligament. We will find it at the bicipital groove, and it will hold the long head of the biceps. Long head of the biceps يعبر خلال bicipital groove, so the transverse humeral ligament will hold it there. It is also considered as one of the ligaments of the shoulder joint. So fibrous capsule, Glenohumeral ligament by its 3 bands, Coracoclavicular ligament, Transverse humeral ligament, and also I have another ligament which is called coracohumeral. Coracohumeral ligament is also considered. And I have a ligament which is called the glenoid labrum. Glenoid labrum. Glenoid labrum, I mean the edge of the glenoid cavity is covered by a hyaline cartilage in order to deepen the cavity to slightly form it into a cup shape. حتى شوية يحوله من منطقة مسطحة إلى نوعا ما cup shape in order to accommodate the head of the humerus. This is also considered one of the ligaments of the shoulder joint. Okay, this is the coracoacromial ligament. هذا شوف الcoracoacromial process. هذا هو الcoracoacromial ligament. Coracoid process, coracoacromial ligament, and the acromial process forms the coracoacromial arch, forming the secondary socket for the head of the humerus. I have a structure called in the joints called bursa. Bursa is an invagination of the synovial membrane, forming a cushion-like structure present within the joints in order to be present beneath the muscles and near the anatomical bony landmarks in order to form a relaxation cushion like structure. هذه البرسة is very important to be present in a joint, and its number differs from one joint to another. كل joint عنده عدد من البرسات خاصة به، بس أكبر عدد من البرسة موجودة بجوينت هو بالني جوينت. الني جوينت يحتوي على تقريبا 13 بيرسة. 13 بيرسة is present in the knee joint، لأن الني جوينت بوحده هو joint very complex، كلش joint خاص بالlower limb. When we will come to describe it in the second semester, you will be aware about. We returning to the bursa. The bursa sometimes even clinically can be inflamed, forming bursitis. In the shoulder joint, I have several bursa. I want you to know that there is a bursa called subdeltoid, or the يعني the subdeltoid bursa اللي أو يسمى subacromial همين. Sub يعني below. You will find it below the acromion process, so it is called subacromial bursa. And also you will find it below the deltoid muscle, so it is called subdeltoid bursa. It's a large bursa, كبيرة كلش، تعتبر one of the large bursa in the body. And it acts like a cushion. It's also important clinically because sometimes supratendinitis, suprascapular tendinitis, يعني supraspinatus tendinitis، من يصير inflammation of the supraspinatus, it can affect this bursa and cause also inflammation to it. Clinically this bursa, even they inject through it، يعني جماعة المفاصل، جماعة الكسور, they can inject a needle through this bursa and give a drug in order to treat it. يعني من يصير bursitis or inflammation, they treat it by injecting intra-articular needle. Okay, we will come also to add the strength of the shoulder joint. أيضا من الأسباب اللي تقوي shoulder joint is the presence of the rotator cuff muscles. What is the rotator cuff muscles? You studied the muscles of the upper limb. You identify that there are muscles that surround the shoulder joint بهالشكل هذا دائري يكون، فراح تسمى rotator cuff muscles. In order to not forget it, it consists of كلمة sits, S-I-T-S. أول حرف من كل يعني تمثل عضلة. sits الأس اللي بالبداية هي supraspinatus، الآي هي infraspinatus، التي هي teres minor، and the S الأخرى هي subscapularis. These four muscles represents the rotator cuff muscles. They surround the shoulder joint, adding for strength for it. يقوي يلزم عضلات من قدام ومن ورا ومن الأعلى كذلك. من تيجي تباوع through also this view, you can find that this is the acromion process. This is the coracoid process. This is the coracoacromial ligament. This is the coracoacromial arch. This is the secondary socket of the shoulder joint for the humerus. And this below هو subacromial bursa. والدلتويد تصير برا فأيضا تسمى subdeltoid bursa. Okay. If I come to ask you, what is the nerve that is related to the shoulder joint inferiorly, you will find the axillary nerve. The axillary nerve is related to the shoulder joint inferiorly. If we come to the clinical correlate of the shoulder joint, it is one of the joints that can be dislocated, and it can be dislocated even easily لأنه مثل ما قلنا الاستابيليتي مالتها الموبيليتي على حساب الاستابيليتي مالتها. فالشولدر joint can be dislocated. It is dislocated more joints that can be dislocated in the upper limb هو shoulder joint. It is جماعة المفاصل والكسور عندهم إنه dislocation of the shoulder is more anteriorly. Subluxation anteriorly more than posteriorly. Subluxation of the joint usually occurs inferiorly. لأنه there is weakness. The weakest point of the shoulder joint is inferiorly. شوفها anterior, posterior, superior, you will find a lot of structures, while inferiorly it is the most weakened part, and even the fibrous capsule is يعني has a protrusion downward. So subluxation of the shoulder of the joint is more inferiorly, dislocation of the shoulder of the joint is more anteriorly than posteriorly. إذا تريد تعرف ليش more anteriorly than posteriorly أقدر أجاوبك anatomically, and I say because the posterior muscles related to the shoulder joint are short. يعني هاي تريزات, teres minor, teres major are short. بينما المسلز اللي صايرة anterior to the shoulder joint you will find it to be more longer. فلذلك يكون anterior dislocation anterior dislocation is more than the posterior dislocation of the shoulder joint. Okay, if we come to the points, حققنا types, حققنا articular surfaces, we talked about the ligaments and the clinical correlates. The movements of the shoulder joint, if we come to the movements, we have flexion, extension, abduction, adduction, and circumduction. These are the movements applied by the shoulder joints. You have a lot of muscles that produce these movements, but I want the main. يعني what is the main flexor to the shoulder joint? What is the main extensor to the shoulder joint? What is the main abductor and the main adductor? The circumduction, as we mentioned in the first lecture of the joints, it is a sequence of movements. It's a sequence of movements in order to form the circumduction, and we said that circumduction is the تقريبا movement of the shoulder joint. يعني shoulder joint is the joint that permits circumduction. When we come to the flexion of the shoulder joint, I have several. The main flexure is the clavicular part of pectoralis major. Pectoralis major, clavicular head, is the main flexure of the shoulder joint. بقية المصلات تسوي flexion? Yes. أنا عندي deltoid هم يسوي, عندي الcoracobrachialis, short head of biceps, كلنا ذن يسوون flexion. بس من I ask the main flexure of the shoulder joint, you say the clavicular head of the pectoralis major. When we come to the extension, the main extensor to the shoulder joint is Latissimus Dorsi. Latissimus Dorsi is the main. Posterior fiber of deltoid همينة يسوي extension. Teres major, long head of the triceps brachii همينة يسوي كل هذين يسوون extension. But when I ask what is the main extensor of the shoulder joint, we mention latissimus dorsi. Movement of adduction يعني towards the midline. أيضا the main adductor is pectoralis major and latissimus dorsi. Abduction, we come to the abduction of the shoulder. I want you to know the initiation of abduction, بداية الابduction لحد تقريبا 15 degree, يعني from 0 to 15 degree is the supraspinatus muscle. So the supraspinatus muscle is the initiator up to 15 degree. بعدين عندي من 15 to the 90 degree إلى 90 درجة يصير عندي supraspinatus and deltoid. فعندك أول 15 supraspinatus لحد 90 deltoid وsupraspinatus وياها. فوق 90 لحد 180 serratus anterior. This is the abduction. يعني هذه movement of the abduction of the shoulder joint is important لأنه sometimes the patient when he explains the pain يقول لك دكتور أنا من أحرك إيدي بالضبط هيك بعيد عن أرفعها لإيدي يبدي عندي ألم شديد بمفصل الكتف. فمن أنت تبدي لحد ال 15 درجة ويعيط معناها supraspinatus tendinitis. لما رفعتها أزيد يقول لك إيه قل الألم لأنه الدلتويد ساعدت. إذا ظليت أنت لحد 90 درجة ما عنده ألم بس فوق ال 90 صار عنده ألم ذيك serratus anterior. So you will understand from this, from the movement, from the initiation and the degrees of movement, what are the muscles that are responsible for such condition. This is regarding the abduction also. طبعا it also applies movements called medial rotation and lateral rotation. So the movements of the shoulder joint: flexion, extension, abduction, adduction, circumduction, medial rotation, and lateral rotation. That was also a quick view about the shoulder joint. Hopefully that you get benefit from it. Try to write the questions that you want in our Google Meet. We will answer it all. Thank you very much.